वो अपना रेसिडेंट जो ग्रुप है उनमें उनको भी जूम का लिंक सेंड करो। वो सेंड द जूम लिंक ऑल रेसिडेंट्स, रेसिडेंट का ग्रुप उनमें भेज दो वो। ओके। और तब तक ये इनका भी चालू रखो काम अपना, लाइव का क्या होता है। शायद उसमें तुम अभी नहीं, हम उसमें थोड़ा कम है, वो थोड़ा देखना पड़ेगा। नहीं, अभी वो हॉल में कितने लोग हैं आप? 27, ओके ओके। और अमलान किधर बाहर है क्या, अमलान और यशस? इधर है, ओके 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 ठीक। नहीं अभी छोड़ दे वो। तो नेक्स्ट टाइम अपना ही करो अच्छा वाला। तो तुम सॉफ्टवेयर का इंटरफेयर मत करो, दैट इज द प्रॉब्लम। थर्ड पार्टी है। तो अभी 2 2 मिनट है बाकी। जस्ट वेट। जिनका ऑडियो आ रहा है ना, वो कोई तो होस्ट करके ना, वो सिर्फ उसको म्यूट कर ले। एक नहीं, बाकी लोगों का भी कर सकते हैं ना, तो जब जैसे ही ज्वाइन होते हो।
सर गुड मॉर्निंग। म्यूट म्यूट है, म्यूट है, म्यूट बंद। हाँ
होय सर. Yes, मला नव्हतं माहिती फ्लाइंग किस दिलं की म्यूट ओपन होत नाही.
हो किस नाही, तोंड बंद केलं.
गुड मॉर्निंग.
युट्यूब वर चालू होत नव्हतं, मी ते प्रयत्न करत होतो.
मीटिंग मध्ये नंतर फोन करतो.
यस, यू कैन स्टार्ट भुवन.
Am I audible?
Yes sir.
Good morning to everybody. By seniors, especially thanks to Dr. Pradeep Patil, Dinesh Patil sir, all my seniors and friends who are listening to me. I want to just share the knowledge of PowerPoint what I know to everybody. That is why I prepared a lecture on this. I should thank Dr. Sanjeev Bhandari, who was behind me for almost 6 months. He prepared the PowerPoint and to present it to show. So shall I share the screen?
सभी का सभी को म्यूट कर ले रहे मैन्युअली, डिस्टर्बेंस आ रहा है। म्यूट ऑल, जैसे लॉगिन जिनका जिनका ऑन दिखता है ऑफ करो। ओके
So I have kept this slide as, am I audible?
यस सर।
I have kept this slide as a jungle. So I think PowerPoint is a jungle in which there are treasures hidden. So we should find the tips and tricks or treasures and the PowerPoint as a jungle. Okay. Now, before going to how to use the PowerPoint, I would recommend some routine usable tools. What is that we will see. Now, if you see here, this is called a ribbon bar. So this ribbon bar, either it can be down or it can be up somewhere here. Okay. Now,
Where is the ribbon bar?
here, sir. My cursor is placed here.
Shape, fill, shapes.
This is the ribbon bar. Sometimes you have to customize that. So how to customize? If I go to this end and if I click this bar here, you get a command as more commands. Okay. Now, if you scroll down, it is written as show the ribbon bar above. Means you will be seeing here somewhere sometimes. So it is better to keep it below. Okay. Why below? Because we will be touching the screen and we will be taking this bar. So the distance is near and the workability is very easier. So if you explore the more commands, now a screen comes up here. On the left side, what you see here is they have given all the details of the routine usable bars. Suppose I want to take bullets here, this side. So just I have to click here and add. It goes and sits in this box. Now see here, the bullets has come here. So this is how you have to customize. Out of that also, another tip I would like to share is, if you see here, this ribbon bar has an extreme left hand and an extreme right hand. So in center, you keep such tabs or such buttons, say text box, pictures, insert, shapes, which are routinely usable for us commonly. So you keep in between. Now how to do that? I will suppose this is the font color is there. Now if I want to take out, you just tap it down. So it will come down. So you bring all those what you require in the center. Extreme left and extreme right are those which are less commonly used. Am I getting?
Yes, sir.
Okay. Now this is the first usable tip bar. Second, you should have now what I'm using is Microsoft 360. Now how to know what your PowerPoint is? You just have to go to the file. Then you have to click the account. In the account here, you can come to know what is that. Mine is 365 official software. If it is not there, there are some new features which can use and it will be useful in the presentation. So I would recommend, and this comes in two types, which is family pack, which is meant for 5 people. 6 TB is free cloud storage. Out of that, per person gets 1 TB and the cost is 6,300 roughly, I don't know. And for per person, if you take for 1% is 4,300 and 1 TB is free. So I would recommend if you want to use the newest features, Microsoft 360 would be better. 365 would be better. So going ahead. Now some of the shortcuts which are helpful in the PPT are, you might be knowing everything, even then I am repeating. So Control A is selection of the text or material. Suppose it is a shape or picture. Control C is copy. Control D is duplicate. Control G is grouping. Now this feature is very important when you are doing an animation. We'll just go ahead. Then Control close square bracket is for increasing the font. Then Control open square bracket is for decreasing the font. Control is S for save. Control V is for the paste. Control X is for the cut. And Control Z is for the undo. So I think these are some of the useful keys which we'll be using from the keyboard itself. Now, first we'll see how we'll see the word and paragraph editing tricks. 1 second.
Pradeep, this has been recorded now because I can't record. It is asking host
No,
permission.
its recording is going on, sir. You can see on the left corner.
Okay.
Okay, now what are the tricks of word and paragraph editing? So usually when you prepare a PPT, it is better to go for a background color, which is solid background color. White background is better for teaching purposes so that the audience gets the light and take the notes. It looks good for X-rays because it gives a contrast, black and white contrast, and you can choose multiple colors, what you want for the text. And it is better for the animation slides, but the disadvantage is the glareful for eyes. Some people get disturbed. Black background is cool for eyes. Cannot use multiple font color. You can use only blue, yellow, or this crimson yellow or white. Style backgrounds, everyone has different choice. It is left to them. Okay. Now coming to the font, title should have minimum of 32 to 36 points. Material should be of 24 to 28. Style should be choose any. These are commonly which are used in the conferences, and better which are easily and readable and accepted. You can choose that. Better do not use thin styled fonts. Now, commonly we face this writing of 20 degrees. So how we can write? What people routinely do is they write like this. So if you see this comma mark, it does not look good. So what I would suggest is you write 20 and the last 0, you select that and you go here in this tab. You click that font tab below. You will get a thing called a superscript. If you click that, default is 30 degrees. If you click that, now you will get a 20 degrees, which is much more readable and appreciable. Okay, that is the trick of writing 20 degrees. Now we commonly use text box. Routinely I use for, suppose if you are posting an X-ray, on the X-ray you can write pre-op. So pre-op, for that small pre-op, you can use a shape, either it can be a square shape or rounded squares, anything, and you write on that. Okay. Then if the material is large, suppose we prepare all the slides, you want 1 by 1 sentence description, then you better take a text box, and then the content should not be displayed all at one time. Instead of showing busy slide, use text animation tricks so as to leave one line at time. One slide should minimally contain or maximally 5 to 6 lines, and to the point it should be. Instead of writing is the, was the, you should not write all those words, and you try to talk and explain to the audience rather than writing the full sentence. Okay, now what I've told is this appears better. This is a pre-production X-ray, so people can appreciate. Presenting is also a bit good, and this is post-production X-ray. You can also use different colors, attractive colors. So this is the use of small shapes using for text box. Now, what are the text animation tricks? There are different tricks. First is appear.
Sambaram, what is the push and button you said? You go back one slide back.
Sir, what I have did here.
Break out and release. Push the.
This is that slide which I had used for the reduction tips in the Solapur Trauma Mate. I had pasted that slide here, so it is nothing to do with the tricks. But I had taken it for the purpose of showing that in the presentation I had used this. So it was the trick which is used in that talk. So I have taken the slide and put it here. So our pertinent to talk is only this Siam picture reduction rate. This is nothing to do with the tricks.
Okay.
Yeah. Now the text animation tricks. There are various different tricks. I will tell you. First is appear and wipe from the left. What is that? I will show you. So if you present like this 1 by 1 sentence, the audience is with you, and it looks better. So how to do that? Suppose this is all the material which you want to animate. So first is Control A. So all get selected. You go to I'll first delete this. Here animation, what I have already done. I will delete this. Now first I'll come here box, Control A, so that all will be selected. Now go to the animations, do the wipe animations is there, wipe. When you click this, another box is there, effect options. It should come from the left, so reading is a bit easier. So now, okay, now but if you see here, everything has 1 1 1 1 1 1, means everything will come at one click, but we don't want like that. So for that you go here, you click it down, and the moment I click here, 1 1 1 will become 1 2 3 4 5. Okay, that is the trick, and this helps us to present as 1 2 3 4 5. So this is the first trick: appear, wipe and left, and start on the click. Now second is changing of the font color. What is that? This is the sentence. Now, as I go ahead and ahead, the text behind becomes colored and less visible. So what is that trick? So we'll again go here. I'll delete this all animations. Sorry. I'll delete all these animations. Now again, coming to here, first Control A, then you write here either wipe from left. Okay. Then again, our next step is on the click, start on the click. Then again, when you come down here, you go to effect options. When you come to the effect options, here there is a after animation, don't dim. If you come here, there are various colors. So now I'll select this brown color. And if you say yes, now what effect will you get? We will see here. See, as I go on presenting, the color changes to light brown color. So this is a trick which will be helpful in your presentation. Now next is busy slide. What is a busy slide? All the material will come at once and the audience will get bored. What they will do, they will read the headings, lines, what you have done, and they will go to sleep. So what is the trick? Trick animation is the disappear trick. What is that? Now what I do here, see, I will make a small shape first, a square shape. I'll fill it with white color and I will tell it no outline. Now what I'll do, I'll bring this and paste on the second line. And what I will do, I will extend this so that all will be covered and I will slightly reduce this. So for this, what animation will I give? I will give the animation as exit animation, disappear. Anything, the trick in the PowerPoint is whatever animation, if you want to give for a single, say, shape, text, you have to, if first is there, when you do the second, you have to go for add animation. If you don't do add animation, the first one will wipe off. So here what I will do, more exit effects, and I will do here disappear. So what will happen when I start my presentation? Don't see the down below. The second one, which is not seen there, the moment I click the shape which was there, it will be exited. So if you see here, now what audience will think, all the arrows on the left side are there, means the audience will think something material is there. Okay. So when you go on clicking, all the things will come. Actually, if you note that this patient was having compound grade 3 segmental loss of radius with compound injury. So what I had done, I had dictated like this. First, upper third radius plate was fixed with small DCP. Exploration of the compound wound was done. What were the findings? There was cut median nerve, ulnar nerve, cut contused radial artery, cut FCR, FDP, FDS of index finger, middle finger, ring finger. Dorsal long thick reconstruction plate was applied to the joint spanning plate. Excised all the loose body, left tissue, bone pieces of the radius. Median nerve, ulnar nerve were repaired, cut tendons were repaired. Vascular technique was used for it. So the audience is with you and you are declaring one point by one. So that is the way how you can keep the audience with you. Am I there? Hello? Hello?
Yes,
Yes, sir. Yes, sir.
Please go on. Explaining it.
Just give me a sound so that I can know that you are there. Okay. Now, what are the X-ray and CM pictures? What are the editing tricks? So if you see here, X-rays are to be taken now usually on a grayscale. Sometimes it appears blue, so it does not good look when you are presenting. So how to take grayscale, I will show you. CM pictures are always to be cropped and displayed rather than a square shape. If you take them on a round shape, it will be very much beautiful. And how to crop and format the picture. So suppose this is a picture which is taken from the camera. Now, if you see here how to make it grayscale, you select this first and go to picture format. 1 minute.
Presentation.
If you see here, picture format here. If I am there.
Yes, sir. Yes, sir.
So if you click the picture format here, now you can go to color. In the color, you can select as grayscale. See here it is grayscale. When I put the cursor, you will note that see grayscale it is written there.
Yes, sir. Okay, okay.
Okay. When you
Yes,
click
yes.
that, it gives a grayscale, or other better is black and white also is there. So if you go on here, color tone,
Hey, please ask people to mute their laptops. You can hear a lot of voice.
भुवन जो जिसका म्यूट है वो बंद करो ना.
so grayscale. Pradeep, am I
भुवन
there?
जिसका आवाज आ रहा है उनको म्यूट करो ना. और कोई तो नया ज्वाइन होगा. हाँ हाँ ठीक है ओके.
So here there is grayscale. I'll select that. So this is now grayscale. So all the X-ray and CMs would look beautiful if they are taken on a grayscale. Now next,
Samaram sir, one interruption. While taking images photo, there are
Yeah.
sometimes there are horizontal lines. By default comes on the picture.
oh
So is there any tool to reduce that?
no, that there is no
No,
tool.
you mean to say you are taking the picture from the screen on your phone?
Photo, हाँ.
Right. What happens there is you have to go about 30-40 centimeters still away from that
Correct, sir.
and wait for that thing to subside. Otherwise, that line comes from the screen, not from your mobile.
Okay. हाँ.
Yes, usually the picture taken from the computer screen, that is from the X-ray department, these horizontal or vertical lines are seen. So better way to have the picture from the X-ray film taken on the view box.
I agree, but suppose when you are operating and you want that picture and you want to show, as Dinesh sir said, if you go near to the computer screen, the lines will come. That time, if you come away and zoom the picture, then the lines will go off. Yes, I had an experience.
Right,
The
sir, right.
second thing you do is you transfer the image to the store side. The
Correct.
store side doesn't have those what you call
Horizontal lines.
lines coming. The fresh image has got it. So you transfer it onto the right screen, then you'll have a stored image that you can shoot.
Yes. Okay. Now this we have seen how to take grayscales. Now second is we routinely face such problem. We take the pictures from the monitor. Now how to crop and group the pictures? Everybody might be knowing. So first we crop the picture. Similarly, we'll do it here. And once you have cropped, you can group them together. You can take the pictures horizontally and show it as right and left also. Okay. Now once you have made this, you pull the picture, you keep aside. And now when you flip this picture format, rotation, you go here, flip it horizontally. And now what you do is you catch shift button both together and Control G. If you do, this is all that you get a single picture, and it is better to put it like this. Okay, this is grouping and cropping of the picture. Now second is how to crop multiple CM pictures to the same size. Now if such you have pictures from your photos taken, so thing is that you first select all, then go to the picture format, and here there is one height. So just type 5 inches or what you want centimeters, and everything will become same at single stance. So instead of all single doing that, so all such pictures you will get and they are beautiful. Okay,
Samaram, repeat. Samaram, just repeat.
Yes, sir. I'll go back. If you have all such sizes which are different sizes, first go to the here slide, click Control A, so that everything will be selected.
Pardon?
Everything will be selected.
No. Split control.
Then you come to the slide here and keep cursor and tap on the screen, and then Control A. A is for selection of all whatever is there on the slide. Control A.
Okay.
Agreed? Now then
Okay.
come to the picture format. When you click this bar, this tab comes here and height is there on the right side. So if
Oh,
I
got it, got it, got it, got it.
you tell 4 inches, 4, everything is 4. So that is at a single click, all the images will come to you. This I will tell when you are presenting the this. Okay, that is how you will crop. Now sometimes cropping of the CM images to the right round shaped. Now this is bit a tedious job. Tedious means first you have to click crop. Before that you select this and go to picture format. Go to the crop. Here aspect ratio is there. You click 1:1, then again go to crop. Again go to crop. You crop to shape. Here there is a round shape. Okay. Now this is the round shape. Again you can crop it. Now you can take the picture round whatever you want like this. If you want to do fine tuning, again you can compress it lightly. So this gives a beautiful round shape. Okay. Now instead of doing all these 4 or 5 steps, the newer Microsoft 365 has an option called as Cameo function. What is that? I will tell you. Now Cameo function is obstructing the bar here. Wait once.
Suppose you have around 5 to 6 images at a time. Can you do it in all images selecting and do the same thing for all?
Every image you have to do singly, but of various sizes you can do all of one size. I'm sorry here, I cannot get that. 1 second.
Yeah, you can do. You can do.
So Cameo function, what is that? I will tell you. See, this is that Cameo function. How I did that? Because here it is showing, see, camera error. Because it is now attached to Zoom, it is not showing the PowerPoint PPT. But what is that function? I'll show you. If you want to show everybody, if they can open Android phone, if everybody is having, and if you open a CM image, okay, and you do edit function there, you will get the first, if you click, you get lasso tool. If you click on that, there will be snap to shape. And on that, if you just roundly on the outline of the CM, if you click that, you can cut it circularly.
Samaram,
Sir.
just go slowly because we have
So
opened it on
one thing, sir, what you can do, some of the resident open the Android phone and he will be seen, that phone will be seen in the person's image. Is it possible?
I was doing the same thing. There is one function, Pradeep, here. If you see, I will do insert. I will and Cameo function. Are you noting here?
Yeah.
This slide, if I do now, ideally my image will be directly seen on the screen. It is as if I am showing you my screen, live screen. That is the function
Yes,
of
yes.
Cameo. But now the Zoom is obstructing that function here. So
Okay.
if everybody can open the Android and open the gallery and one picture of CM.
Samaram sir, can you show this on your mobile facing to us?
1 second. Then I have to stop sharing. I'll stop sharing. Again, I'll come back.
I can see your face now, so we can show there.
I'll stop sharing and again I'll come back.
He's
Chalega?
sharing from his mobile.
I will show on mobile. I will show 2 seconds. Okay. Now, if you see here, if you show only my screen, it will be better.
श्रेयस सर का सिर्फ स्क्रीन वो कर डिस्प्ले
वो मुश्किल है. That is difficult. No.
ठीक है, चलेगा. I will tell you the steps, sir.
ठीक है.
You can.
Okay, all of us have opened up one CM image on our mobile.
Okay, sir. There is a second down button. Edit pane sarka hai. You open that. You click that.
Which one?
Edit function.
Yeah, edit. We have opened the edit function.
Edit function. Then out of 5 bars below the first, which has 4 this, you click that.
No, crop and rotate.
Crop and rotate करा के सर.
नाही क्रॉप एंड पहिले क्रॉप करायचं का त्याला?
नाही तो फंक्शन दाबल्यावर त्याच्या वरती एक असं डॉटेड सर्कल लाईन दिसतो. स्नॅप टू शेप म्हणून येतो.
नाही सर.
एक मिनिट.
No, when crop and rotate is one option is rotate, second is mirror, third is crop.
हा क्रॉप.
आता इथं स्नॅप टू शेप एक फंक्शन आहे.
पण कुठे आहे? आमच्यात
नाहीये.
स्नॅपचॅट नाहीच
That
आहे.
is not on Android.
अँड्रॉइड मध्ये बघायचं सर. ह्याच्यात नाहीये. आपल्या आयफोन मध्ये नाहीये. अँड्रॉइडला दिसते.
Android मध्ये पण नाहीये सर. I don't know.
पण विका आता.
हा, इथं माझ्याकडे आहे, दाखवलं असतो, पण आता देर इज प्रॉब्लेम. एनिवे
ठीक आहे.
ठीक आहे ठीक आहे ठीक आहे ठीक आहे.
Okay. Now, I wanted to tell, instead of doing all those 4 steps you have on your camera, mobile itself. So with that you can see. Now there is one designer feature. Designer feature is what? Suppose if you have placed this slide on the normal slide shape and on the home screen. Now this home tab is open here, left side, and at the end there is a designer feature. The moment I click, the PowerPoint gives you various generating ideas. If you see here nicely, it has some generating ideas. If you click this here, so it will be like this, or if you click here like this. So this is a designer feature which is available on Microsoft 365. See, this also, it has automatically arranged all the pictures. So this is a designer feature that is available in 365. See here. This is the designer features. Now, next going ahead is how to format a dark picture. Now you have got a picture which is so dark and you want to format it. So I will just show you. Now suppose I want to format this dark picture. First click that, then go to picture format. Or you can also right click on the same image. You can have a tab here, format picture. Here, if you click various things, corrections will be there. Last picture corrections will be there. In that, if you see the brightness here, it is very low. I'll go on slowly increasing and you can note the changes. So a bad picture can be converted into a good picture. Okay. Dinesh sir, getting?
Yes sir, yes sir.
Okay, yeah. Second is, sometimes we take a full length X-ray obliquely. We tell our staff diagonally, ge baba mala purna disal pahiye, varta joint, khalsa joint. You have taken, but when you are presenting, it is difficult. So if you try to keep one on another, again it will be like this. If you try to bring ahead, front, it will come on this. So how to? I did a small trick here. So what to do is, what I'll do, I'll take one picture, I'll select this, and I'll go select the shapes. Here, freeform scribble tool is there. So what I'll do, I want this much portion to go away. So just I'll take the pen and I'll cut this much portion. Okay. Now, what I'll do, I'll come out, I'll select this picture first. I'll catch the shift button and I'll also select this. And then later on, in the shape format, I'll go up. In the merge shapes, I will come here. So I'll remove this piece. See, this piece will go away. Only in my hand, this piece will come. There are few here, small pieces left here. So again, you can go here, scribble tool. You can just again redraw this, take a more excess part, and now again same, come outside, click the main picture, then shift button on, click this also on, go to shape formats, go to merge shapes and remove that. So click outside. So this will go away. If you go on deleting, only what remains is this much portion is remaining. So if you do the same thing here also, what image you will get on both films is this image. Now if you do here, if I do separate, I have done cutting like this, and what I have done, I have taken a square shape and I have pasted it.
तुला नाही माहिती का? बर 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 बर. हा हा.
Hello. Hello.
Yes, sir.
Then I will put it on a black background, and viewing this is better than the first what we had seen. Okay. Agreed?
Yeah. So, can you make a straight line?
Yeah, you can make. Only thing is that shape tool, scribble tool is in our cursor, which is in the mouse. So you get some disturbance. Otherwise,
Okay.
straight, if we can do straight, it is well and nice. But presenting is like this. Our eyes look in a shape AP and lateral. This is much more better than that two films which are diagonally placed, obliquely placed. Now, sometimes we get oblique picture, some resident or somebody has taken, and this is a obliquely taken X-ray, and you want to put in a presentation. So how can you correct that? So for that, again, you have to click on the same picture, go to format picture. When you come here, there are various tabs open. In this, there is one 3D rotation. In 3D rotation, perspective is the option. You're seeing your cursor.
Yes, sir. Yes, yes.
So what will happen? Look here just. When I do this or this at one instance, it will look up horizontal to you. So that is how you can correct. You can rotate the image. See, it is rotating. So obliquely taken X-ray can be corrected to horizontal and then placed in a better way. And now if you crop this image, and paste it, it is a better picture than previous. Okay, that is how you will correct in a perspective tool, what we can use. Now, sometimes you can use the animation on X-rays also. This was the patient done somewhere else with the tibia nail put in the reverse fashion. So what I had done, I had passed a nail and I had shown that routinely Herzog's bend is posterior, but in this case, it is anterior. So you can use those animations also on the X-rays itself.
How do you do that?
Okay, sir, we'll see in the picture animation trick.
Okay.
Yeah, this is now the most good something in PowerPoint is picture animation. What you are seeing is not a video, but the animation, it is a GIF. Means all the slides are converted to GIF to show in one sequence all the things. Now I passed a guide wire on the top of nail, a nail comes, and then two guide wires pass, limb is straightened off. And in the other down below, you can see corrections of this. All I have done in Solapur Trauma Meet. So I'll just share with you. So before you start the animation, your plan should be fixed. Suppose you want to show that you are fixing an intertrochanteric fracture. So then how was it the fracture? It was in varus. How did you correct? Then what are the tricks? Then you fix with the K wire and then you passed a guide wire. So all this I will just share with you. Before starting any animation, your plan should be fixed. Try to revise the things you want to show 2 to 3 times before starting the animation tricks. Because going back one step is a bit difficult after completion of the PPT. And how to make fragments of this picture, just I will share here. I'll come out and I want to break this picture. I want to remove femur from this. Okay. Now what I'll do, I'll go to shape. Again, I'll use this free form.
PowerPoint tricks చెప్తున్నాడు ఆయన.
In this, you just go on drawing the outline of the femur. Now, this is what I've selected. Okay. Now the same trick what we had used, you will come out. First select the main picture, press the shift button, press the shape what you have done, go to the shape format, and then in the merge shapes, there is one option called as fragmentation. See here, there is a fragment.
Who is Shirish? Shirish asked him to mute his thing.
Dinesh sir, I'll go ahead.
Go
Yes,
ahead.
sir.
Go ahead.
In the fragment option, you are seeing fragment option there. The moment I do fragment option and I come out, this piece will now get separated. See here, it is separated. I'll show it again. Pradeep,
Yes, yes.
Once again.
Please show it again.
see, this is now a complete picture. It is moving. Okay. Now what I will do, I'll go to first shapes. I'll take a scribble tool here. A pen comes here. Now come down and just move along the border of the femur what you want. Sometimes the color does not fill. So the trick is that you go here and you ask fill shape. That gets filled up. Okay. Now after this procedure is over, you come out, click on the sides of the X-ray. Then again you select the first, you click the main X-ray, press the shift button and click now what shape you have done there and go here. If you do in the shape format, your one tab opens merge shapes. In that, if you do fragment, now if you come and click here, the fragment what you have done will come out. Okay, and there.
Yes, sir.
Now this is
Yes,
how
sir,
you
yes.
this is how you will take the femur part out. So what you want to show the animation. Now the next is you have taken the femur part out. Now again what you will do, again the same procedure, you want to show two pieces. Okay. Now again you do the same trick here, you show two parts. Okay. Now if I want to show intertrochanteric, again I'll go to the shape, scribble tool. Then what I'll do, I'll select here, I'll go here, I'll come here, then I'll do like this. Okay, now same trick, come outside, click. Now click the main picture, press the shift button, press the shape portion, go to format, go to format shape, go to merge shape. Do the now if you do fragment, different this one. Now small portion you can delete from here. The small black lines which are left, you can delete, and now you will get two parts. Okay. Now this is how you will get two parts. Pradeep, I am there.
Yes, sir.
Yes.
Okay, this is how you will separate the from the main pelvis X-ray femur. From the femur, you will separate IT portion. Then what we'll do is you are having two pieces in hands. This is how you got two pieces. Now the important part is what are the different tricks we use in the animation processes. You get when you open the animation pane, this is what you see: entrance animations, emphasis, and there are more below more exit and motion paths. So what commonly we use, the first is the spin option. How we will use, I will see every one step by step. Then grow and shrink tool. Then grouping I have already shown. You X-ray also I have shown. Control G, select that 1, 2, and then Control G. It creates a group. That is useful in the animation trick. Then motion paths are used for K-wire, screws, how they go. I will just show you. Then the exit effect I have shown in that text animation. You prepare a square and that will go out. That is helpful here. Then entrance also appear and disappear. And exciting effects are there, compression of fracture, how that we will see. And there is also importance of effect and timing option. All these are the tricks which are used in the animation process. We'll see that. I have already shown the grouping. I have shown if you want to have group function, this is how we select one. Now they are different. If you note that this is moving, this is moving. Okay, like that. If I keep it near and if I select one and select two, and if I press Control G, now this is a single unit. So if I now catch this, it will move with single here and there. So that is the use of group G. Group G, how we can use fast this. And now next is use of spin animation. Okay, now if you see on the slide view, slideshow, this is the intertrochanteric fracture which has gone in varus, the proximal fragment has gone up. So now this fragment, what you want to show is, you want to show that when you give the traction, it will get corrected. Now, how can we show this spin animation? How can we show is, first you take this piece out. So take this piece out. The trick here is that you have to prepare a duplicate of this and paste it below. Okay, so what I'll do, I'll go to shapes. Again, I'll take a scribble tool. And now I'll just on the border, I will just do like this. So now this is the same as the head portion. I'll bring it down. And now what I will do, I will rotate the neck, base to base neck. I'll rotate and keep it here. Okay. Now I want to group these two. So what I'll do, once I have selected, two I have selected, pressing the shift button, I will do Control G. Now this is the single piece. If I don't do group and if I try to use the spin motion animation, what will happen? I will just show. I'll give spin animation to this. If you go to animate and here, if you see, this is the spin animation. Okay, I'll select here. And now what will happen? It is rotating on itself only. See, it will be rotating. So we don't want that. We want something which we had seen earlier. See this. We want a smooth function. So how can this be achieved? Now this we have done as a single unit. Okay. Now if I apply spin animation to this, it is rotating on the center is now here. Base of both center is here. So it will rotate smoothly. Okay. Now what I'll do, I'll open the animation pane. In the animation pane, I'll click below. In the effect option, what I'll go, the moment you click, you get like this picture. Here, what I'll do, go to custom and give option at 30 degrees. You write 30 and do enter. If you don't enter, it will not get action. And we want clockwise. Sorry, head should rotate clockwise. The moment you see this effect, you will get here. If I click here, that is the first one. That is the second one, what we had seen. And this is the third one, what we have done. So this is the spin animation. This is how you will correct the virus. This is a trick, spin animation tricks. Now we'll see how formatting of background. We want to, now if we have separated the femur from the main pelvis, we have done two pieces. Now we want to show that how to fix. So I've taken this from the Google. Now I want to separate Richards plate screw and Richards screw. So what I will do is I'll first select this, then I'll go to picture format. The moment you come here, you do remove background. You get such picture. Now, okay, it means we have separated the Richards plate. Now, if you want to keep this, you can keep. But before what I will do, I will make three pieces of this. First, I will do remove the Richards plate. I got it. If you note here, there are keep changes is written there. So I'll keep that. I'll click that. Now keep changes means what I've got in hand is now the Richards plate. So what you do, you crop this. You crop this plate. And you keep it aside. Okay, now you have got the Richards plate. Second, you select here. You send it to back. You select this picture, go again to picture format. You do remove background. Now again, what will happen? That Richards plate is there, but I don't want that. So what you do? There is another plate here. That is why it is not taking. I'll remove. Our best way is I'll delete this. I want now the screw. So what I'll do picture format, remove background. Now, what I want to do is I want discard all the changes. Okay. One by one, we can remove this.
टाइम जाने का तो है काम नहीं तो करो.
See now in this, if you see here, the left here, there are written there marks to keep and marks to remove areas. So I want a screw. Now what I will do, I'll click that and you get a pen here. I want this screw. So just draw a line on this screw. Now the screw will come out. You don't want the plate in this picture. So what you do, mark areas to remove. So you slightly right on this and that Richards plate will go away. Okay, now this is the screw we got. Come outside and again click this, crop it, make it smaller size because it is now a big size. Like that, you can get all Richards plate, screw, guide wire, nails, whatever you want, you can separate from that main picture. Okay, Now you have to make all such small collection. So what I've done here, you have to make all such the, I have taken K-wire is also there. So you can take K-wire from there, and then you can use that K-wire and place it here. And the effect what you get by grouping those, when you group and use a spin option, you will get such option, picture. So this is how one by one animation used. Motion path, what you have to do, suppose motion path where it is used in a K-wire. Suppose I have said here, I have now done the reduction from virus to the normal positive reduction, and now I fix this with 2 K-wires. I have taken K-wires from the net and I have shown this. So first is appear and second is motion path. So this is the use of motion path animation. Now we'll go for a transcervical fracture neck femur. Now in this X-ray, I have shown how to cut that. We have taken that cutting. Now we have done 2 pieces are the transcervical neck femur. So I have done the duplicate for spinning action I have shown. And then what I will do, this is the fracture what we have to show initially. Then with the help of spin action, we have slightly rotated and we have got correction. This is the picture of correction. Then from the net, we have taken all the screw, Richards plate. Now these 3 are there. This is the guide wire, which I'll show you how to fix this here in a second. So now that picture was there, we have done the reduction of transcervical fracture neck femur. We want to fix, select the guide wire. First, you make it appear. The first animation is what is should be taken is, it should be appear. That is the first animation. Then select this, we want to fix to the main, go for add animation. And here motion path is given. Okay, there are different motion paths. So what we want is it should go to the left up, but sometimes it may not be there. So what we'll do, diagonally up right we'll do. We'll select anything. There are 2 points, if you note here, green point and a red point. Dinesh sir, are you there? Dinesh sir, Pradeep.
I can't see the green end point, whatever you are talking.
Sir, here I'm placing my cursor here.
Where?
My cursor is seen or no?
No.
Cursor is not seen.
Yeah, it is.
या K-wire वरती इथं ग्रीन पॉइंट आहे का नाही? हे बघा आता मी हे हलवतो, हलते दिसतंय?
नाहीये सर, नाहीये.
कर्सर नाही दिसत सर.
बरं हे हलते ते तरी दिसतंय का नाही? K-wire
काय हलतंय ते दिसत नाहीये.
K-wire हलते तेही दिसत नाही.
नाही दिसत.
अरे बापरे, इथं झूमचा प्रॉब्लेम असेल, कारण इथं when you give motion path there are 2 dots, usually a green and a red. आता मी काय केलं होतं, I made animation appear. हा दिसतोय आता?
नाही
नाही दिसत.
नाही.
स्क्रीनवर काहीच दिसत नाही.
फक्त तुझं इमेज दिसतंय, ते फ्रॅक्चरचा साइडवर इमेज दिसते.
स्लाइड स्टँड स्टिल आहे आता सध्या.
हा बरोबर.
सर नेक्स्ट स्लाइड घेऊन बघा.
एक मिनिट. आता दिसतो?
नाही. Your image is freezed on the screen.
सर स्लाइड फक्त चेंज करून बघा.
नाही, एक काम आहे. एक मिनिट सर.
हा
शेअरिंग नाही, मला 1-2 मिनिट स्टॉप शेअर करून तो पॉवर पॉईंट सिलेक्ट करावा लागेल.
हा ठीक आहे.
जे तुम्हाला दिसेल तो एक वेळा एकच दिसतो. आता दिसेल सर. आता दिसतंय का?
आता बघा.
आता दिसतंय का?
ओके,
आय एम सॉरी फॉर दॅट. सर हा इथं तुम्ही जेव्हा हे तर क्लिक केलं, लाल दिसतो आता?
हो दिसतोय.
आता आय विल गो फ्रॉम फर्स्ट. आय विल जस्ट डू द डिलीट एनिमेशन्स. Sir, here there is a K-wire. Okay.
Okay.
Now we have the reduction of transcervical fracture neck femur. I want to place a K-wire. So the first animation, I took this from the net. Our first animation, what I will give is the appear animation. So I'll click here, appear animation. So I want the second animation of the K-wire. Again, I will select K-wire and go for the add animation. and I'll go for the motion path. Am I fast?
No, no, sir.
No, you're okay, you're okay.
And then I will select here diagonally up. असू द्या diagonally up तर up, right तर right, ठीक आहे. You go here, select. Now you can see here 2 dots. दिसते green आणि red.
Oh,
तर तुम्ही आता ग्रीनला आहे तिथूनच चालू व्हायला पाहिजे. But red you want where? You want in the head and neck portion. So you take this. Sorry. एक मिनिट तो. You click that first. हा लाल दिसला, हा उचलायचा
Oh,
आणि then you place where you want.
okay,
इथं
okay,
पाहिजे
okay.
आपल्याला. Okay. Now if you see the animation, what you get is हा reductionचा X-ray transcervical fracture has been reduced. I have taken a K-wire and I have placed in the head and neck. So that is the animation. Now second animation काय येणार, मी Richard screw घेतो. What I'll do is I'll place here. I'll make it to appear. Again, the first trick is make it animate appear. Then second, again select that. Then go
Motion.
for the add animation, motion path. Then select diagonally upwards.
Okay.
परत हे घ्या, लालचं कुठं पाहिजे तुम्हाला, you want somewhere here. So you place it here. Okay. Now the third, what you want to have a plate. Plate ला काय करा, इथं आणा, इथं ठेवा तुम्ही. You just keep it here. And then first animation would be appear. Then the second animation, again add animation, motion path, then diagonally upright. तर आता प्लेट तुम्हाला कुठं पाहिजे, हा इथं पाहिजे. 1 second, I have to bring it here so it will be nice. So here I have done. So all the animations, if you see here, first K-wire, fixation of the fracture, then second Richard screw, then placing the head neck, then the third will come and sit. And the last animation काय करतो मी, ह्याला 4 स्क्रू आहेत तर त्याला 4 वेळा D करतो, कंट्रोल D. ओके. आणि ह्या सगळ्या स्क्रू एका वरती एक ठेवतो. चार स्क्रू आहेत असं एका लाईनीत आणतो आणि I will just group it. I will select all one by one आणि I will do control G. आता एक ग्रुप झाला, मी काय करतो इथं आणून ठेवतो. The first action is appear. First I will click that, sorry. First animation is appear. Then the second animation for this is motion path.
Here the motion path will be horizontal, no? Isn't it?
ते जर नसलं तरी आपण त्या लालला उचलून ठेवायचं. आता डायगोनली, आता इथे लेफ्ट अँड राईट असतो, हे बघा लेफ्टला इथं लेफ्ट, आय क्लिक दॅट. आता काय करायचं, हा स्क्रू कुठं पाहिजे आपल्याला, यू हॅव टू बी इन द बोन. सो रफली इट इज ओके. So my full animation, if I scroll down, sorry, appear
How did you stop those screws at the plate level? So what order you do?
एक मिनिट सर, जस्ट एक animation राहिला, I will tell that.
ह्याला MS ऑर्थो शिकलेलं परवडलं.
हो सर, हे थोडं वेगळं करायचं.
That is much easier.
सर आता you want the screws at what place you asked, नितीन सर. तर हे बघा इथे लाल टिंब आहे, तुम्ही लाल टिंब आहे ना, टिंबला एकदा क्लिक केलं की ते कुठे बसतात ते दाखवतं. समजा मला पुढे घेऊन जायचं, जस्ट ड्रॅग दॅट अँड पुश इट अप. तुम्हाला कुठं पाहिजे, जस्ट प्लेस इट दॅट. सो द ऑल animations, if you see what we have done now, एक K-wire घ्यायचा, you have passed and fixed the fracture, then you have took the Richard screw, you have fixed that, then you have took a plate and then you have placed it on the shaft femur, then I have taken 4 screws, then I have fixed in the shaft. So this is how you create animations.
Now how you show the compression, if you want to show the compression?
Compression ला मी येतो, एका ह्याच्यात पुढचं दाखवणार आहे. Again I will stop sharing, I will go to another PowerPoint. So these were the tricks of animation. Now it needs some time actually. It is not, you have to sit and do, and once you are doing that, you
And
will
not
get.
only time, one has to sit on the computer and practice it.
Yes, sir, agreed. Agreed. Then only the beauty of this will come. So this was that I have shown you group motion path I shown you. Okay. Now then, so I had presented these all animations in Solomon tournament. I was also not knowing. I have tried this. The topic given to me was reduction tips in a simple IT fracture. That was my topic. I was knowing from the Shiva's talk, you have to place the perineal post on the normal side of the ischial tuberosity. And then you have to start, because if you place on the fractured ischial tuberosity, the perineal post will obstruct the proximal fragment and the distal fragment, and the fracture will open. These were the tips. Continuing to that, how I have presented, you will note here. This is what happens if the perineal post is in the center. To start with, we first do the reduction in abduction, internal rotation, and then stabilize with the fracture with the K wires. These were the K wires. I have shown motion path. I have fixed the fracture. Now, after this, we do the adduction to the limb to take the entry point. And with the perineal post in center, normal adduction, what we get is almost 15 to 20 degrees. Okay. But if you try to do more adduction, what happens if the fracture is stabilized and do the reduction, do the adduction more? Perineal post will obstruct the proximal fragment from adducting, and there will be opening of the fracture side. Okay. Thus, and with the K wires in place and the post in the center, now if you do more adduction, the perineal post will obstruct that. And now, initially, first there will be strain on the fracture side, and if you do more, there will be opening of the fracture side. So that was how I presented in this animation. And then thus we have to keep the, आता हा इथं तुम्ही झूम मुळे ते दिसेना सर, हा सेंटरचा पेरिनियल पोस्ट साइडला जातो. It is taking some time, lag effect is there.
दिसला होता, दिसतोय ना?
दिसतोय का सरकलेला दिसला?
हो, दिसतोय.
Thus we have to keep the perineal post on the normal ischial tuberosity. Now with the K wires in situ, and if you do adduction, you will get the adduction up to 40 to 50 degrees. Thus in this position, taking of the entry point medial to GT is much easier. I have shown the owl, I have taken the entry point. Then passing of guide wire is much easier. Then rimming, if needed, can be done in this same position. Then I have removed this. Then I have exchanged the beaded with the plain guide wire. Then I took a nail. Then the nail is passed over the guide wire. Limb is abducted. After the limb is abducted, then guide wire for the cervical screws are passed, kissing the calcar. This is how I have shown two different colors, because you have to differentiate K wire from that. Then the first derotation screw is passed. I have sent it. I have drawn the motion path I have used here. The second, I have screwed the motion path I have used here. Then what I have done, I have removed the K wires. Provisional K wires are removed. I have again used the motion path in a different direction. Then traction is to be released. For the traction, I have shown two arrows from below. They will go upwards to the motion path. Because of this, what will happen? Now Nitin sir had asked compression. So I had shown a star mark, and I had told verbally that this causes compression. So that is how you can, first compression is there. Then alternate tightening of the screws. Both screws is done. So what I have done, I have taken two small spots, blue and green. First, I will show that I am tightening the top screw because I want to get the valgus. And alternatingly, the second will also start roaming. And as I tighten the color change, you are seeing that is the compression effect. So that was what used for the compression purpose. So this was the animation done in the Solapur Trauma Meet. The topic was just a simple tricks and tips and tricks for simple IT fracture reduction. Then what I have done for the distal interlocking fixation, I had taken two screws and passed it off. So this was the simple IT fracture. Another case I had selected, this was a comminuted fracture upper third of femur. This was the preoperative picture. So what I had done, I have taken the cuttings of all those from the X-ray. And what I have shown, initially the traction was applied. That arrow goes down. Then after giving traction, this is what happens. The fracture started opening. Then the middle fragment, for that, what I had done, I took a Steinmann pin. With the Steinmann pin, I had closed the gap. So what I had done, I placed a pin there and I had grouped that now together, the bone fragment. And the next, what I had done is I had showed that I had pushed the fragment near to the head and neck fragment. So this was the animation. Then what I had done, I had taken, fracture was fixed. We achieved positive reduction in both AP and lateral planes. And then the fracture was fixed with two thick K wires in the far anterior cortex. I had taken two K wires and I had shown that I had fixed this. Now what I had done, to make the middle fragment and the head neck fragment to a single unit, I had passed a thick Steinmann pin into the head neck fragment, and then I had passed it, so that now that behaves as a single unit now. Thus, the limb was now adducted and internally rotated. So you get the effect like this, as if you have done the adduction and this. Now in this position, I took the entry. I took with a owl. I took the entry. Then I had passed a guide wire, weighted guide, and I had done the routine nailing. So this was the animation pertaining to that X-ray. So all these were shown on the IITV pictures. Now you can see the opening of the fracture in the first, positive reduction in AP and lateral. Then I had fixed with the, I had pushed that fragment. You are noting there with the pin, I pushed that fragment. Then I had fixed the fracture with both AP and lateral far anterior cortex. Then I had took another Steinmann pin. I had passed into the head neck fragment, so that making it a single unit. I had passed a guide wire entry medial to the GT. Then in the lateral, that was the entry point. And then I passed a guide wire in AP lateral. Then the middle fragment was kept always pushed nearer to the, or pushed to medially, to not to show there should be no distraction at the fracture side, and the guide wire is in the center. So this, the nail pass, all this subsiding Siam pictures, but the animation makes it somewhat look beautiful. These were the further pictures, and this was the pre-op X-ray. This is the post X-ray, and this is the full length X-ray and the lateral X. So this is what I had used the animation. Okay, now this was the animation shown in VIROC. Sir, these were all, this was given, case was of Pradeep sir only, but sir wanted to present me. So sir had given this many slides to me, nothing more than that. So on the basis of this, I had gone through all the slides. So how I presented there was, this was a patient of lateral column to type 2 injury, in which the patient had sacral fracture and both anterior column fracture. The plan was decided to fix anterior as well as posterior elements. Percutaneous iliosacral screw for fracture sacrum, anterior rami fixation was planned. So this was positioning of the patient, end on view of the sciatic notches was seen, and this was the selection of the entry point in the lateral. This was the entry point in AP view, and the guide wire was passed. While drilling with cannulated drill bit, the guide wire got broken. So this was the picture, and this was the guide wire was broken, and the piece was left inside. The picture left was this picture. So from here, I started the animation. I had shown that I had placed a guide wire, and on the top of the guide wire, I had placed a reamer, and I had drilled that, gone up to the distal extent. But when I was removing, I noted the guide wire was broken. This was the broken guide wire, and then did not remove the guide wire, but made a path for the removal of broken guide wire. We made the path. Then the next step was very crucial. 6.5 cannulated drill bit was always filled with the guide wire. I had shown the guide wire top, and I had changed the color of the guide wire, because just to the same color, stainless steel color would not give an impression. So I had changed the color of that picture, and the cannulated drill bit was always filled with guide wire, so that the canal of drill bit was empty. Otherwise, the canal of the drill bit, if you go on drilling, what will happen? The bone marrow I had shown, it will start filling the cannula. So this was the animation. So if you don't keep a guide wire within the reamer, cannulated reamer, the marrow comes in the drill bit and you will be unable to grasp the fragment. This I have shown. Now the empty, I had gone ahead, I had removed that. And now on the top of that, I had sent a guide wire. Then they have taken a screw, cannulated screw. On the top of that, I had placed. Then the later guide wire was removed. Thus, this again, all steps showing Siam pictures of the same. All the time, cannulated drill bit was checked in AP inlet outlet view that it was engaging the broken guide wire. It was captured and it was totally removed. And this cannulated threaded screw was passed. This is the perfect. So if you have the plan, then you can do it. Up till now, Pradeep, any questions? What you want?
Wonderful, Venugopal. You have removed the broken K-wire from the sacrum, very difficult, inaccessible area. Your knowledge or your tact to remove that. This has
Shashikant,
enlightened me very much.
this is not my case. I only removed from PowerPoint. Sir has removed
By
original.
the way, that screw is mine.
पॉवर पॉइंट साठीच तुम्हाला कॉंग्रॅच्युलेशन म्हणायला लागले. ते जास्त अवघड आहे ते पॉवर पॉइंट वर काढले.
Ashit,
नाही
thank
नाही
you.
PowerPoint पण नाही PowerPoint is also important to demonstrate. No, I would like to congratulate for both the PowerPoint presentation as well as the tactic live surgery.
नाही समारंभ काय माहिती का, आम्हाला एका साईडला आहे तुझं पॉवर पॉईंट, दुसऱ्या लॅपटॉपवर ओपन करून अजून एक लॅपटॉप घेऊन त्याच्यावर प्रॅक्टिस करावं लागेल. कारण we will have to use two screens to practice this.
So for that sir ना एकदा लाईव्ह म्हणण्यापेक्षा फिजिकली घ्यायला पाहिजे आणि सगळेजण with सुद्धा असून करायला पाहिजे. That is the
त्याच्याकरता काय आहे
workshop.
की he should be in the hall with all delegates having the laptop in their hand.
साठे कोचिंग क्लासेस.
Course
साठे
fit
कोचिंग
in.
क्लासेस.
तर मी पहिल्यांदा जेव्हा मी सरांना स्लाइड्स दिले एकदम अचानक पडलं, सर ते तुम्ही रिमर कसं काय काढला म्हणलं. मग सर सांगितले की तो कॅनल एम्प्टी ठेवायला पाहिजे, हे क्रक्स आहे. मग मला लक्षात आलं की दॅट इज द पॉइंट वेअर यू हॅव टू हायलाइट दॅट पॉइंट, कीपिंग द एम्प्टीनेस ऑफ द ड्रिल बिट. सो आय कॅप्चर्ड दॅट अँड डन दॅट. Okay.
We were witness to your presentation when we were at Mumbai.
Yes, Nitin sir. Okay. Shall we go ahead?
Yes sir, go ahead.
Sometimes we use the book pictures as our slide. So you can use
मला
that.
एक कळत नाही, जेकब म्हणून कसं काय चिडगुकर दिसतोय.
ते
नाही,
माझं
नाही.
चेकअप म्हणून ते झूम वरती. सॉरी,
तेच मला कळेना.
कोणाला कळू नये म्हणून आहे.
जॅकबचा मोबाईल आहे.
Hidden identity. असे
नाही जॅकबचा विकत घेतलाय.
संभराम सर, ते
बोला.
क्विक कॉमेंट, सोलापूरच्या प्रेझेंटेशन मध्ये लोक म्हणले पॉवर पॉइंट वाल्यांना पण माहित नाही एवढं करता येतं म्हणे, जेवढं संभराम सरांना कळलंय.
ही चेष्टा करताय सर.
It was a very good presentation. We learned a lot. Venu, thank you.
Yes, sir. Yes, sir. How to use the book pictures as your slides. So I want to show here in this slide, I have used the trick of shrink and grow tool in animation. What is that? I'll show you. In this picture, you will note here, there are the ascending femoral vessels when we are doing the anterior approach. So we have to show that. We have to give importance to that point. So what I have done, I have used the tool, shrink and grow tool in animation. So what I have done here, I have shown that in this slide, sartorius, in between the sartorius and the tensor fascial lata, when you go there is the vessel, lateral circumflex femoral vessels are there, and these vessels should be ligated. So I had done this zoom, shrink and grow and tool in animation. So that because of actually Zoom platform, it is not getting so much effect here. I am unable to see, but the persons where the Ashit was there, shrink and grow tool, he knows that if you zoom it off, it will nicely show. Again, it will shrink off. So I wanted to stress that point. That is why the shrink and grow tool is used in here. Now, simple animation tools I have used. Actually, Dinesh sir was there, I think. In the trauma med, Solapur trauma med, proximal femoral fractures. Pradeep sir had given a talk of femoral head fractures. Femoral head fractures, but I was not knowing that. I was not having any. Neither I had in safe surgical dislocation. Neither I had done. We did not have any video. So what I had done, I had taken book pictures. That this is how I presented there. So this shows the skin incision. The skin incision should be 7 centimeters above the tip of the trochanter and 7 centimeters distal. That is how I made a different color line to show the skin incision. After cutting TFL, you get two muscles, piriformis and the quadratus femoris. At the lower border of the piriformis, you get the inferior gluteal artery branch, and at the upper border of the quadratus femoris, there is the ascending branch of medial circumflex femoral artery. So to highlight that, just I have made square boxes, arrows, and different colors, so that will take the eyes of the audience to that structure. Next, creating a space between the piriformis and the gluteus minimus. This was the space, so I made an arrow there. And now I will separate the vastus lateralis just below the ridge. Then for stressing the digastric osteotomy, there is already one second. Already there is a saw here shown, but what I had done, I had to highlight that I have made a shape of saw and again I had removed that so that the people will recognize the saw is there. Then I had showed the direction with the dotted line. I will do the osteotomy of the greater trochanter. I will go up. Now what is this you get after digastric osteotomy? That at the upper border is the gluteus medius and the lower is the vastus lateralis and is between is the greater trochanter. So that I had shown there. And then when you retract it anteriorly, you'll see the anterior capsule. On the anterior capsule, I will do the Z osteotomy, and that was I have shown the anterior capsule, and this is the Z osteotomy I had shown there. Z capsulotomy, sorry. Then after that, I will dislocate the hip anteriorly, and the last picture what you see is after cutting the ligamentum teres, this much portion of the head is seen. So I had stressed that this is what you get the view, and in this view, you are now able to fix the fractures of femoral head. And again, the advantage of this safe surgical dislocation is the posterior wall fragments are retracted anterior, so they can also be reduced and fix it out. So this was the use of book pictures. Only with the help of shape, I had highlighted the steps of the surgery. That is how you can use. Okay. Pradeep, got it?
Yes, sir.
Then now there is slight transition. In the transition, I will show you. If you go back to here, there is one menu called as transition menu. Now in that morph, this second one which you are seeing here, this is a very important tool. What difference does it make? I will show you. Just the effects, what will it makes, I will just show you. So when you morph the slide, when you on a click, that square will go, it will become rectangle. And
Recording in
from
progress.
start. आता नुसतं असं वेग प्रेझेंटेशन होतं. So the effect is gone off. So this morph effect can be used how I had used here in this case when I presented the perineal post, which moves from one place to another, means center to normal side. We do more adduction, the perineal post pressing on the proximal fragment, opening of the fracture is initially seen, strain first and opening of the fracture. Now if you see smooth जणू काय आपण सारखं. This effect is only because of that morph, slight transition morph effect is there. Thus we have to keep the perineal post on the normal issue. Similarly, there is another curtain transition in PPT. I had presented Solapur Trauma Meet all budgets session where so preparation phase I had given one talk. So in that I said Shiva was the scientific chairman, and that time all the program started, and this was how the hall was seen. So this will give beautiful effect, curtain effect. So if you note here, if you come to the transition, means how one slide will go. This is the curtain slide. So how one slide will go on another, that is called a transition. And to our medical practice after this morph is very important when you are doing animation purpose. So that is effect. Now coming to the last, embedding of fonts is one of the topic. What will happen? So this is useful when suppose you are preparing. Now the font which you are seeing is not seen in any routine laptop. So I like this font. This is Cavallini font. So I had kept in my font menu. But when I take the PowerPoint to somebody else, they might not be having that, and that font is not seen. So if you want the same font to be seen on their laptop also, what you have to do is when you're using this font, you have to save. You come to the file here and you have to go to the options here and you have to go to the save menu. In the save menu, there is one portion called as embed fonts in the file. So when I click that, this says that embed only characters used in the presentation best for reducing the font. And when I click here, even if that PPT laptop does not have this font will be seen there. That is sure. So this is the importance of that embedding of the fonts. And second is when you have to send PPT to somebody else, you have to, they want to see your PPT without animation. So you can send it in a PDF format and a small size it will become. And when you want that other should see your PPT but should not copy slides, you can very well put lock, but if you put a lock, they cannot open the PPT. You want to see, make them see your PowerPoint, but don't copy the slide. So this is the best option, saving of the PPT as a PDF format. Then this I wanted to share Slide Master. So what is the use of that? why do you use Slide Master? When you want to put the hospital logo or emblem on the PPT, when you want to put the date, when you want to put your name, and some fixed changes you want. Means all the time you don't want to go font type Arial or say Comic Sans. So then that can be useful in the Slide Master. So what is that Slide Master? If you go in the view section, here there is a Slide Master. Okay. Now if you scroll upwards, there will be a Slide Master. I have done here, I've kept here. So this is the classical Slide Master in which you get the master title style, then all first level, second level, third level, how you want. Then is already intrinsic date is there, then the footer, then this. So what I have done, I have removed all this and I will show you now. I will just give you a example. Now I want to put my name. So what I will do, I'll take a text box and write Dr. Venugopal. Okay. Now this name I want to be seen in all slides. Okay, agreed. Now second is I want an emblem. So what I'll do, I'll go to pictures. Then I'll go to my desktop. Then here there is one hospital logo. This hospital logo I'll select. Now I'll make it small. This hospital logo you can paste it behind and make it water wash. Water wash means go to color and this is watermark. It is a bit slow because of zoom. So this is why washout picture. If you don't want that and if you want it at one corner, you go and say none. If you want it at one corner, just click that and make it small. Make it small and just keep it at the top. And now if suppose if you want today's date, so again take a text box and write 7/1/24. So this should be seen in all slides. Okay. Now just I will come to normal view of the slides. Every slide will have that changes.
Okay, and slide numbers?
You can put that slide number also. Now actually I have to close the Slide Master view. I
Okay.
did not do that. That is why I'll again do that.
So once you have put this on every slide, it will come. Yeah.
Yes, sir. Yes, I am. मी ते चूक केलं मी दाखवतो परत एकदा. I'll go to Slide Master. आता हे झालं. I have to actually close the Slide Master view. यायला पाहिजे. I also don't know why it has not happened. एक मिनिट. View. Slide Master. इथे तर मी सगळं टाकलंय. आता क्लोज म्हटल्यावर नॉर्मली यायला पाहिजे.
नाही आता एक काम कर तू तर यू क्लिक फॉर अ न्यू स्लाइड नाव.
नाही सर नवीन येणार नाही इथंच करायला पाहिजे. हे स्लाइड मास्टर मध्येच यायला पाहिजे.
नाही स्लाइड मास्टर मध्ये एक नंबर स्लाइडच्या खाली अजून एक क्लिक कर सेकंड स्लाइड करता ऍड कर स्लाइड ब्लँक स्लाइड त्याच्या खाली नाही गो अप. हा आता आपण जसं ऍड करतो स्लाइड 2 स्लाइडच्या मध्ये क्लिक करतो बघ. हा तिथे ऍड कर. हा सो इट विल कम ऑन एव्हरी स्लाइड.
सर इथं आलं पण माझ्या त्या स्लाइड वरती यायला पाहिजे.
काय म्हटलं?
मी क्लोज माझ्या आता प्रेझेंटेशन जे आहे ना
हा
इथं एक मिनिट इथं बहुतेक आलेलं दिसतं ना. हे अॅनिमेशन स्लाइड्स मध्ये आलं नाही.
खाली 107 ला आहे बघा.
आता आलाय बघा सर. हे बघा सगळीकडे आलंय बघा माझं नाव आणि हे बघा दिसतंय बघा.
कळलं.
नॉट देअर इनिशियली. सी इट हॅज कम इन एव्हरी पॉइंट एव्हरी पॉवर पॉइंट डॉक्टर वेणुगोपाल विसर 7-1 आणि सगळं आलं बघा. सो यू क्लोज द स्लाइड मास्टर अँड इट विल कम.
Okay.
हे बघा सगळीकडे आला बघा आता.
बरोबर आहे.
So that was the trick of slide master. Okay. So this was all what I was knowing about PPT. And last function is one zoom function मी दाखवतो. There is one tool called as linking of the PowerPoint. Linking म्हणजे काय? Suppose you are presenting your presentation. समजा पेल्विसचं तुम्ही anterior pubic symphysis करत आहात आणि somebody wants to know what are the complications, but you don't want to talk those portion in this routine presentation. But if somebody delegates ask you what are the complications, so at that time you can make some picture or tool. Now here I will take you to another link. तर मी काय केलं, असं स्लाइड प्रेझेंट करताना समजा तो विचारला कॉम्प्लिकेशन, सो दिस इज लिंक विथ दॅट कॉम्प्लिकेशन, तो जाऊन तिकडे चालू होतो. सो दॅट इज कॉल्ड एज लिंकिंग.
ओके.
एग्रीड सर?
ओके ओके सर.
आता काय
And now
माहिती का,
Zoom
मी एक 10 दिवस थोडं हे डायजेस्ट करतो आणि देन प्रॉब्ली आफ्टर अबाउट अ मंथ ऑर सो वी विल कम बॅक टू यू इंडिव्हिज्युअली टू शो व्हॉट वी हॅव डन आवर वर्क. इफ यू हॅव डिफिकल्टीज we will put
Yes,
it on
sir,
the
I will.
SOS group.
Yes,
Yes,
sir, चालतं.
so we can arrange online. नाही, if possible, we can arrange online workshop.
नाही होतं काय ऑनलाईनला
हा.
आपले इंडिव्हिज्युअल लॅपटॉप्स ओपन पाहिजे आणि समोर टीचर सांगायला पाहिजे.
हा,
ते
हा.
प्रत्येक 10 लोक 10 प्रश्न झूम वर विचारतील. इट विल बी केओस ऑन झूम.
ठीक आहे.
सर आता हा झूम फंक्शन एक राहिला आपला. झूम फंक्शन काय आहे, व्हॉट आय विल टेल यू, जस्ट आय विल गो टू अनदर, आय विल स्टॉप शेअरिंग अँड आय विल अगेन शेअर विथ यू.
मनमथ राऊत साहेब आत्ता जागे झालेत की काय, तू पहिल्यापासून आहेत?
डिस्कनेक्ट झाले असतील कदाचित.
मी एक सांगू का, हे माझ्यासाठी रिव्हिजन झाली ही आता. आता मला जास्त समजल्यासारखं वाटतंय. सरांचं लेक्चर असं जेव्हा परत होईल तेव्हा तुम्ही सगळे परत एकदा ते अटेंड करा, की त्याच्यातून मग ते जास्त कम्फर्टेबल वाटत. पहिल्यांदा ऐकल्यावरती मला पण असंच झालं होतं की हे काहीच आपल्याला झेपणार नाहीये म्हणून. पण इफ यू अटेंड इट वन्स और ट्वाइस और थ्राइस, ते जास्त परत 3-4
Not only that, you have to sit with your own laptop and keep on playing with that for at least 5-6 times.
Yeah, basically you go into animation and then you will figure out that process.
Exactly.
पहिली स्लाइड होती त्यांची
हो,
की
हो,
दोन ग्रुपिंग करणे आणि मोशन फॉलो करणे,
हा.
ग्रुपिंग करणे, मोशन फॉलो करणे, हे खेळत बसलो की होऊन जात होते.
होऊन जातं. करेक्ट सर. नाव दिस इज अ झूम फंक्शन विच आय वॉन्ट टू टेल यू. समजा तुमच्याकडे एवढे स्लाइड, आय सीइंग देअर, आय विजिबल?
Yeah.
So there are A to J. I have written the slides only ABCD. समजा मला 3 स्लाइड पहिल्या केसच्या आहेत, नंतरचे 3 स्लाइड दुसऱ्या केसच्या आहेत, नंतरचे 4 स्लाइड तिसऱ्या केसच्या आहेत. तर 3 केसेस मी तयार केले. तर मला समजा प्रेझेंट करताना पहिल्या केसवरनं तिसऱ्याला जम्प करायचा आहे किंवा दुसऱ्यावरनं पहिल्याला जम्प करायचं आहे. इन्स्टेड ऑफ टेकिंग एस्केप अँड सीइंग ऑल दॅट, दिस इज द बेस्ट फॅसिलिटी व्हॉट दे हॅव गिव्हन. सो व्हॉट यू हॅव टू डू, यू हॅव टू सिलेक्ट हिअर, देन यू हॅव टू डू युअर इन्सर्ट.
No, we can't see what
दिसत नाही, दिसत नाही.
दिसत नाही.
हो थांबा सर,
We can only see your screen.
थांबा थांबा 2 मिनिट. येस सर, येस 2 मिनिट. आता दिसेल बघ नाव.
Yeah, screen sharing चालू झालं. Correct.
ओके नाव दिसतंय सर. A to J पर्यंत मी स्लाइड्स तयार केला. A to
Okay.
J. ओके
Okay.
नाव समजा पहिले ABC पहिल्या केसच्या आहेत, DEF दुसऱ्या केसच्या आहेत आणि GHIJ तिसऱ्या केसच्या आहेत. तर मला केसेस तयार करा. हाऊ, देर इज अ फंक्शन कॉल्ड एज इन्सर्ट अँड यू हॅव टू कम क्लिक ऑन द झूम. यू हॅव टू डू युअर समरी झूम. समरी झूम क्लिक केला की ते विचारतंय तुमचा पहिला केस कुठला आहे. यू हॅव टू जस्ट क्लिक द स्लाइड. मग दुसरा केस कुठला आहे, माझा डीचा आहे, हे क्लिक केलं. तिसरा केस कुठला आहे, जीचा आहे. So when I do all this and if I tell insert, a new slide comes into action आणि त्याच्यामध्ये सगळे when I
Okay,
do
okay.
the play, आता बघा मी समजा G वर क्लिक केला तर माझे पुढच्या स्लाइड चालू होतात G पासून. हे बघा. सो GHIJ परत झालं की ते परत पहिल्याला जाणार. तो परत आय कॅन कम टू केस 1. केस 1 ला मी क्लिक केला परत ABC चालू होतो. ABC चालू होतं. C संपला की परत तिकडे जात आहे. हे बघा. दिस इज कॉल्ड एज झूम पॉवर पॉइंट. सो इट इज व्हेरी गुड टूल इफ यू से हॅव अ लॉट्स. समजा ABC किती बी 4-10 केसेस किती असू दे. And what today I have used that, if you see here, because I was always coming out escaping to action, तुम्हाला दिसलं नाही. Had it been there, how it could been seen, I would just tell you here. मी पहिल्या स्लाइडला जातो सर. हे बघा माझं इथलं हे मी इथं आलो. सो आय कुड टॉक लाईक दिस. हे सगळं संपला की माझा तो झूमचा स्क्रीन येणार. हे बघा आता मला समजा पिक्चर एक्सेलला जायचं डायरेक्टली मी क्लिक करणार झुपकन तिकडे जाणार. हे बघा. ओके.
Okay, correct. So you have to keep your presentations in separate formats and then arrange them as you want to present them.
करेक्ट. मग तुम्ही नाव द्या त्याला केस 1, केस 2, केस 3 किंवा काही पेल्विस केस, प्युबिस केस वगैरे वगैरे वगैरे.
Correct.
येस सर. सो दिस वॉज माय प्रेझेंटेशन. थँक यू एव्हरीबडी फॉर पेशंट लिसनिंग.
No, thank you for coming on Sunday on the Zoom.
Yes.
So everyone can start start camera.
Thank you, Sambaram.
Thank you.
Samba, thank you very much.
Thank you. शशिकांत.
अजून एक दोन वेळा रिपिटेशन झालं की होऊन जाईल.
हे परत ऐकता आले तर बरं होईल.
So no,
हे recorded?
the meeting has been recorded. मी नंतर थोडा YouTube ची लिंक पाठवतो.
Okay.
That you can revisit it again.
Yes.
So एक
Thank you.
प्रदीप, हे आता तू रेकॉर्डेड कुठे पाठवणार?
Please सोलापूर
हा
सोलापूर ऑर्थो ग्रुपला टाकतो ना मी.
हा ठीक आहे.
सोलापूर आणि कोल्हापूरला टाकतो.
YouTube लिंक असेल.
हो YouTube लिंक असेल सर.
ठीक आहे.
So I thank you Sambaram sir for sparing time on Monday, especially I think he was busy till yesterday. So thank you sir. It was a very excellent presentation, especially for the residents. Even though the participants are around 16, we have around 25 residents sitting in a hall. So that comes around 40 people watching. And next time we will be doing a better way. So thank you very much, sir. Anyone wants to add something, you can please add.
No, see, those who are
Zoom platform needs a laptop. On iPhone, it is difficult to understand.
Yes,
no,
sir.
you should not
have a
open on
desktop.
iPhone. You have to open on laptop only.
Yeah. Because it becomes so
Secondly,
small.
the important thing, how many people are using Keynote or MacBook for presentation? These things are not possible on Keynote. And Microsoft, Sambaram sir has paid 4,500 rupees for 1 year, isn't it? Is that
Yes,
correct, sir?
Yes, I agreed.
To get this
365
effect,
is a paid thing, huh?
सर पेड वर्षन आहे तो ऑफिशियल वर्षन आहे.
So
आणि तो बोरिंग पार्ट काय आहे सर?
how many animations are there in free version? All are there, or there are some restrictions?
नाही तेच तर इश्यू.
नाही तुम्हाला
Okay.
अॅनिमेशनचे सगळे असतील पण बाकीचे फीचर्स भेटणार नाही. ओनली बोरिंग थिंग इज यू हॅव टू सिट देअर, यू हॅव टू प्ले विथ दॅट अँड ऍज यू गेट अॅनिमेशन बरं वाटतं देन यू स्टार्ट गोइंग डिफरंट अॅनिमेशन. दॅट इज द ओनली बोरिंग पार्ट.
Okay.
मला भांडणाचे मागे लागले 6 महिन्यापासून, अरे तू दाखवतो अॅनिमेशन, आम्हाला शिकायचं आहे, तू प्रेझेंट कर. मी म्हणलं ठीक आहे करतो.
ठीक आहे, चलो आय विल लॉग आउट नाउ.
येस सर.
Okay, sir. Thank you, sir. Thank you everyone.
संबाराम सर एक पाठी लावा आमच्याकडे प्रेझेंटेशन करून मिळतील म्हणून.
पेड वर्क.
पेड वर्षन. ठीक आहे. थँक्यू ऑल.
ओके
थँक्यू.
चालेल. थँक्यू. बाय.
बाय.
सांगितलेलं आहे तू तसं आणू नको 20 मिनिटामध्ये क्लास लावू नको बरोबर 12 मिनिटामध्ये